When a person with TBI has emotional challenges, it can significantly affect other family members. And what happens is that other family members will often report that their loved one with the injury will overreact to things. So we can see all types of variations, right? So on one spectrum or one end of the spectrum, a person can almost be hyper reactive and they can overreact. You could say something or do something that is normal everyday pattern and that person can go off. That person can become very intolerant and quickly lose their patience, and along with some of the other behavioral things that might happen in the injury where they become less filtered, they're likely to maybe say very nasty things or say things that are very hurtful. And that can be taken very personally, so that can hurt kids, right? That can hurt the children's feelings. It can hurt a spouse's feelings. And after a while, family members start to feel like they're losing patience for that too. So they will then react and pull back and give less support and make that person feel less, more isolated, more alienated. So these emotional issues only escalate. On the other end of the spectrum, some individuals with brain injury can actually have difficulty tapping into their own emotional experiences. So they might feel bothered by something and they will react, but they won't know that they're having some kind of reaction to it, or they might not react at all. And that can be very bothersome to loved ones. So if I'm a wife or a husband of somebody that has an injury and I'm feeling hurt or upset by something, but I see no reaction from my spouse, then I'm going to feel like they don't care or they've lost their ability to feel compassion or to relate in that relationship with me. Kids will similarly experience that from parents that are injured, and it can very much disrupt that. And sometimes the person with injury can't even tell others' emotional responses. So whether a person overreacts or completely underreacts or doesn't react at all, or just reacts wrong, those things become very upsetting to family members. And what was once a family member that was very protective and nurturing of the person that had the injury, after about 6 months of that, those family members start to, like I said, pull back from that relationship, and they will oftentimes start to react just as harshly to that person. It just escalates, and it causes a lot of problems down the line, where those are the individuals that come back even years later, and they may have gone back to work, they might be driving, they might look okay, and there's no visible scar or sign, but the biggest disruption is the problem where nobody seems to want to support them or be around them, and they feel rejected and isolated in their families and in their jobs.